Hello, everyone. Yeah. It's 7 exactly. We're going to take a few minutes welcoming everyone for the next 5 minutes. So as everybody joins, we're going to wait kidogo. Good evening. Welcome. Welcome everyone to our today's mental health webinar. Welcome everyone. We're going to spend the next 5 minutes as we wait for others to join. At exactly 7:05, we will begin. Good evening. Good evening, everyone, as you join. We have a minute. We'll begin in the next 1 minute. We are still welcoming everyone to join us. Please feel comfortable. Hello, Moses, karibu. You're welcome. Hello, Haria. We receive your greetings from Nakuru. Welcome. Welcome, everyone. Thank you, Ruth. You're welcome. Good evening, Atieno Wino. You're welcome. Thank you, Ruth. You're welcome. Okay. I think we are into time and we are supposed to be beginning from now.
We need to start, Francis, please.
Yes, we are starting. Just to start by introducing myself, my name is Francis Onduto. I'm a medical psychologist. I'm registered under Medical Psychologists Association of Kenya, and I'm really, really privileged to be with you and to be the moderator of this session today. Now, I will invite Dr. Kigondu of KMA to give the opening remarks. Dr. Kigondu is the Secretary General of KMA. Doctor, are you there?
Thank you very much. Thank you very much to everyone. I think Kenya Medical Association would like to thank all those who have participated in these psychological webinars. A specific appreciation is to to Josephine Ohas and the team, and welcome also Francis. We welcome you to the we've been running these webinars for some time, especially post-COVID. And for me, this specific one, being a gynecologist, is very dear to my heart because I can see it's touching on matters after delivery. And thank you very much. And with that, I don't want to waste too much time with a lot of talk. I think we can continue with the CME.
Okay, thank you very much, Dr. I would like to start by welcoming everybody to this beautiful evening session. It's a new month. Today is the 1st March, and it's the beginning of the month, so I believe everybody is happy. So everybody feel welcome. First, I would like to thank you for joining us this evening, and I hope you will be able to learn and benefit from it. Our topic of discussion today is unprecedented challenges among healthcare workers with postpartum depression. We know it is extremely vital to care for health workers' mental health, especially during these unprecedented moments and times. An understanding of the challenges healthcare workers face is very important for us, and that is why we are holding this session today. Our speaker today for this session is Jacqueline Anundo, and is going to speak to us on this particular topic. Anundo is going to speak to us on this session, and I would like to take a few minutes to introduce her. But before I do that, I would like to first welcome our people who are here. I will acknowledge Dr. Were of KMA, who is the KMA chair, the KMA CEO, Dr. Njoki, the MPAC National Chair, Aflin Tafi, and MPAC Secretary General, Julius Baraza. I would also like to acknowledge those who have worked so hard to organize the weekly webinars. I acknowledge the CPAK Chair, Dr. Liz Kaemba, Dr. Koba, and Dr. Ohas of Kenya Psychiatric Association of Kenya. As we are going to go through this session, I would just like to remind us, everyone who is joining us, that you will be getting the CPD points, which are you'll be getting through email. I believe all of us joined through our email. So prepare for the same. Without further ado, I would like to introduce our speaker, Jacqueline Anundo, who is a clinical psychologist. Actually, she's a registered clinical psychologist with over 15 years experience in mental health treatment, training, and research. She is the clinical director at Kisiwa Wellness and Psychosocial Support Services, which offers the following services. One is mental health assessment and treatment, mental health talks and training, mentorship and career coaching programs and research. Jacqueline has published 6 journals articles in the area of mental health. She is currently pursuing her PhD in clinical psychology at Daystar University. She held a Master of Science degree in clinical psychology from the University of Nairobi. Her hobbies are doing charity work for children, traveling, trying out different recipes, photography, reading, swimming, watching movies and series, and Formula One sports. So that is a comprehensive biography of our speaker today. And as you can see, she's well conversed in this area. So without wasting time, I'm going to invite Jacqueline to take over and take us through this session. Jacqueline, welcome.
Thank you very much, Francis. Good morning, good afternoon, good evening from wherever you're joining us from. Indeed, it's a pleasure and an honor to be here, to be giving you this talk. This is not my first time to be here, but I'm really happy to be here once again. I'm happy that on the call, we have people who are specialists in this area. So I know that in the areas where I will not have mentioned, they will come in to fill in, and we are going to be able to complement each other on this topic. This is a very important topic, and it is a topic that many people don't know about it, yet it is something that has been said to be causing a lot of sleepless nights for new mothers, new fathers, or in families. So let's see what it says. Feel free to post your question on the chat, or once I'm done with the presentation, then myself and the panelists here will be able to take your questions. I want to believe that everybody can be able to see my screen.
Yes, you can see a screen.
All right. Okay, thank you very much, Francis, for that introduction. So because of time, I'll just go straight into it. I'll start by defining what postpartum depression is. And from research, you're told that it's a complex mix of physical and emotional and behavioral changes that happen in some women. Please note that the word some has been highlighted because it's not in all women, and this happens after giving birth. According to DSM-5, PPD is a form of major depression that begins within 4 weeks after delivery, and the diagnosis of PPD is based not only on the length of time between delivery and onset, but also on the severity of the depression. So these are very key things to look at when diagnosing PPD. What's the etiology of PPD? It is linked to chemical, social, and psychological changes that happen when one is having a baby. And these chemical changes involve a rapid drop in hormones after delivery. However, the actual link between this drop and depression is still not very clear, according to the studies that have been done. However, we are told that the female reproductive hormones, that is estrogen and progesterone, tend to increase tenfold during pregnancy. However, immediately after delivery, they drop. Other hormones produced by your thyroid gland also may drop sharply, and it may make one to feel tired, sluggish, and depressed. So the people who are coming to see this newborn, to see the mother, would be wondering why you've brought in a bundle of joy, but you look so depressed, you look so moody. So why would this be happening to you? It could be as a result of the hormonal drop. We are told that 3 days after a woman gives birth, the levels of these hormones tend to drop back to what they were before pregnancy. So in addition to these chemical changes, you find that there are also physical and psychological changes of having a baby, which might create an increased risk of depression. For example, when you're sleep deprived and overwhelmed, you may have trouble handling even minor problems. Even when a baby is crying, you may find that you may have difficulties handling that baby. You may be anxious about your ability to care for a newborn. And we've had numerous times, new mothers saying that, I don't think I have motherly instincts, simply because they're going through all these emotions. Pregnancy itself may make one to develop certain physical changes, and many women tend to feel quite unattractive during this period. And this makes them to struggle a lot with their sense of identity. You know, they feel like they have lost control over their life. So this is a time when a woman has a lot of self-image issues, and they tend to be overly stressed. Studies that were done during the COVID period have also indicated that the COVID-19 pandemic exacerbated maternal anxiety and depressive symptoms and made that mother-infant bonding worse. You find that also pregnancy and childbirth constitute considerable stressors that are challenging to the health of the mother and reveal underlying susceptibility to psychiatric morbidity. So this tends to increase the experience of a depressive episode, and this is highest during this time of pregnancy. And we have been told that it affects about 10% of new mothers. We have different types of postpartum depression. One of them is what we call the baby blues, and this happens to as many as 70% of women in the days immediately after childbirth. During this period, many women develop mood swings. At one point, they feel so happy. At another point, they feel very sad. They may cry for no reason, become impatient, cranky, restless, anxious, lonely, and sad. So the baby blues may last only a few hours or 1 or 2 weeks after delivery. The other type is postpartum depression, which is the major topic of today. And this can happen a few days or even months after childbirth. PPD can happen after the birth of any child. So please note that PPD may happen to to you with your second born and not your third, and maybe with your fourth born, or it may happen to you with all of your children. So it is not a preserve only of the first child. So it can happen after birth to any child and not just the first child. And it can make one to have feelings that are similar to baby blues, only that they are more intensified: sadness, despair, anxiety. You become lethargic. Even things that you used to enjoy before, you find that you no longer enjoy them. Yeah. And these feelings are much more stronger than the baby blues. The other type of PPD is postpartum psychosis. And this mental illness can happen quickly and often within the first 3 months after childbirth. Women can lose touch with reality. The women who report auditory hallucinations. In particular, I once had a patient who kept telling me that anytime she was in a vehicle, there's a voice that would tell her to open the window and throw the baby out. So sometimes these auditory hallucinations can be quite strong to the point that the person can actually do exactly as the voice is instructing. They also experience visual hallucinations and even delusions. The symptoms here are insomnia. They feel agitated and angry. They pace up and down. Sometimes the baby might be crying, but they're pacing as if they're not even concerned. They're restless. They're also suicidal, and they experience strange feelings and behaviors. When you look at the prevalence of postpartum depression, we are told that approximately 70% to 80% of women will experience at a minimum the baby blues, but these will go away after a very short period. The reported rate of some type of clinical postpartum depression among new mothers is between 10 to 20%. In one study, we are told that 1 in 7 women may experience postpartum depression in the year after giving birth. So it means that if all the women on this call today, if we are to count, 1 in 7 of us is likely to experience PPD, with approximately 4 million live births occurring in the US. And this equates to almost 600,000. This equates to almost 600,000 postpartum depression diagnoses. About 1 out of every 10 of these women will go further, not just to develop the baby blues, but also to develop a more severe and long-lasting depression after delivery. And about 1 in 1,000 women will still go further to develop postpartum psychosis that I've just talked about. Tragically, these women who develop postpartum psychosis, the cases end up resulting in suicide or even infanticide. Up to 50% of women will face a reoccurrence during subsequent pregnancies. So sometimes maybe you had the first child, you had PPD, the second one, maybe you didn't have, the third one, you might have, the fourth one, you might have. So there's a 50% chance of having a reoccurrence. And it has been projected that by the year 2030, if interventions are not developed as part of preventive measures, depression might be the top 3 leading causes of death globally. And despite this, because there are numerous studies out there, despite this, PPD is one of the least addressed types of depression today. And we are going to see why as we continue with the session. Now, if you thought that it's only women who suffer from PPD, then you're wrong. Even men suffer from paternal postpartum depression. Research indicates that 1 in 10 men may experience paternal postpartum depression. So the men on this call, if you are to count 1 in 10, 1 of you out of 10 may experience paternal PPD in the year after the birth of your child. Earlier on, I talked about women having hormonal changes that could cause PPD. Even men do go through these hormonal changes. And a study that was done in 2017 and published in the American Medical Journal found an association between lower testosterone levels and paternal PPD. According to this study, as the hormonal levels decreased, they noted that the depressive symptoms increased. However, the reason why this hormonal level dipped is still not yet understood. And we've been told that the PPD ranges from 24% to 50% among men whose partners were also experiencing postpartum depression. Maternal depression was therefore identified as the strongest predictor of paternal depression during the postpartum period. So here you have a new mother who is experiencing PPD, and because of what they're experiencing, you find that the man also starts experiencing some of these symptoms. And a study that was done in 2021 revealed the following, that PPD was a major disruption in the lives and the relationship between these men and their spouses. I want to quote, the men experienced fear, confusion, and much concern for their spouses and felt unable to help them in overcoming postpartum depression. That inability to fix the problem created frustration and anger. And that is why in the signs and symptoms, most men who have paternal PPD become very aggressive. The majority of the respondents reported that they made many sacrifices to hold the relationship and the family together. Even though the PPD improved over time, fathers were left to face an uncertain future with a spouse who seemed to be very different from the person that they had previously known. And the reason for this is because when a woman is going through postpartum depression, all attention is focused on the woman. She gets a lot of psychosocial support, she gets social support, and you find that in most cases, the fathers are neglected or they're ignored. So you find that by the time the woman is getting over the PPD, the man is still left wondering and becomes uncertain about the future. Some of the risk factors include, if you have a history of depression in your family, so before becoming pregnant, please ensure that you're able to disclose this to a mental health professional or to your doctor. Also, during pregnancy, if you discover that you're pregnant and you have a history of depression in the family, please inform your doctor. This information is very, very important. Age at the time of pregnancy, the younger you are, the higher the chances of you developing PPD. How do you feel about your pregnancy? If there's ambivalence, then you're at risk of PPD. We are told that children, the more you have, the more likely you are to be depressed in the later pregnancies. However, this is debatable because some of us come from very large families, and it might be argued that my mother maybe had 10, had 13, had 8 children, but we didn't see any signs of depression. However, this is what research says. If there's a family history of mood disorders, know that you're at risk. If you're going through an extremely stressful event, a health crisis, or a job loss, then you're also at risk. If you have a child with special needs, this can put a toll on both parents, and it puts you at risk of developing PPD or paternal PPD. Having twins or triplets, twins and triplets are very wonderful, especially when they start walking. But during the early stages of taking care of them, it can take a toll on the couple and even on the family at large. Having a history of depression, I mentioned that, and even premenstrual dysphoric disorder would also predispose one to that. If you have limited social support, if you're living alone, and also if you're in a toxic relationship, all these are risk factors for PPD. This one I talked about, the signs and symptoms of PPD, particularly for baby blues. There are mood swings, anxiety, sadness, irritability. One feels overwhelmed. There's crying a lot. And sometimes the crying, there may even be no reason for crying. Sometimes a man would ask the wife, have you eaten? Something as simple as that. And the woman can just burst out, and start crying. So we find that sometimes this leaves men wondering what they have done or what they have failed to do, because someone would just be crying for no reason. And most women, when you talk to them, women who have PPD, they'll tell you that they also don't understand why they are crying. There's reduced concentration, appetite problems, and trouble sleeping. When it comes to postpartum psychosis, there's confusion, disorientation, obsessive thoughts about the baby, hallucinations and delusions, there are sleep disturbances, there's excessive energy and agitation, there's paranoia, then attempt to harm yourself or others. When it comes to postpartum depression, the depressed mood or the severe mood swings can linger for a long time. There's excessive crying, difficulty bonding with the baby, and the people around this mother would be wondering, what type of a mother are you that you're refusing to bond with your baby? What they may not know is that you are going through a series of negative emotions that even you don't understand. Withdrawing from family and friends. And remember, when you give birth, that's the time family and friends would like to visit you. But for this person going through PPD, the person would rather stay away and withdraw from family and friends, loss of appetite, insomnia, overwhelming fatigue, reduced interest and pleasure in activities that one used to enjoy before. There's irritability. And then there's that fear that you're not a good mother. Most mothers say that maybe I don't have the motherly instincts, or maybe I'm being punished for something I did. There's hopelessness, feelings of worthlessness, shame, guilt. Why is it that I cannot be able to bond with my baby? Yeah. Diminished ability to think clearly. One becomes restless, anxious, and then there are panic attacks that one experiences. And then there are very active thoughts of harming yourself or even the baby, and that's what leads to suicide. So for men who have paternal PPD, this is what they go through. Because of that inability to fix the problem, they don't understand what is going on. There is increased anger and conflict with others at home and also others in the office or at the workplace. In order to manage their stress levels, they self-medicate with alcohol or drugs. They feel frustrated and irritable. Because of this increased anger, they become violent. They experience significant weight gain or weight loss. Isolation from family. They become workaholics where they just want to be at work because the situation at home is unbearable for them. They don't know what to do. They don't understand what is happening. There's impulsivity. It can lead to reckless driving or even extramarital affairs. Sometimes when you try to explain to your relatives back home what is happening in your house, they may give it a cultural explanation, and the solution would be, why don't you get another wife? Because even them, they don't know why your wife is behaving that way. Which mother would refuse to bond with their own child? Yeah, what's wrong with your wife? So you'd be encouraged to marry another wife. They feel discouraged, they become cynical, and then they increase complaints of physical, of headaches, indigestion, and even pain, unexplained pain. There's problems with concentration, loss of interest in activities previously enjoyed, work, hobbies, even there's a loss of interest in intimacy. There's fatigue, feeling, remember I'd mentioned that a woman would feel like crying for no reason. A man who is also going through paternal PPD may also feel very teary at some point. And for men, they try to be strong, not to show others that, they're crying or they want to cry. So what happens is that during this process of self-medicating with alcohol, most men become disinhibited and find that a man would just start crying. Or some of them would go and cry in secret. There's conflict between how you feel you should be as a man and how you are based on what is happening. Remember, what has happened in the family is a good thing. A newborn has been brought home. But what is happening after the birth of the newborn is making you start to second guess yourself. Yeah. Then if this goes untreated, there are thoughts of suicide or even death can occur. So at what point do you seek help? Untreated postpartum depression can be dangerous for new mothers and their children. So if symptoms persist for 2 weeks, the symptoms that I've mentioned above, and you find that you cannot function normally, you cannot cope with everyday situation, you have thoughts of harming yourself or the baby, you feel extremely anxious or scared, or even you panic all the time, then it is time to seek for professional help. So some of the challenges that among healthcare workers is that the symptoms of perinatal depression can be difficult to distinguish since some symptoms like tiredness, guilt, and even anxiety are common after a long shift, or even you've been in a heavy shift. So you find that this implies that the risk for missing these red flags is quite high, because you may be assuming that you're just feeling tired, you're just feeling fatigued because you're from a heavy shift. Yeah. The assumption that you're a medic and therefore you should know what to do for yourself or your spouse is also another challenge. It is, you're expected to know what to do. Yeah. The stigma around PPD, there is societal expectation of what you as a medic, what is expected of you, or what is expected of you as a woman or as a man. There's assumption that in case something goes wrong, you will just detect. After all, you are a medic, and it is expected for you to know this. Sometimes you are told that mganga hajigangi. And sometimes you may be experiencing these depressive symptoms, and you may not notice. It may take someone else to tell you, so that the person can bring it to your attention that you have changed, something is not right with you. And one way to identify women in need, or even men in need of supportive for depressive symptomatology, is through screening. And the diagnosis is complex because there are no exclusive physiological parameters. Therefore, there are instruments that have been developed or they have been created to be able to measure and characterize postpartum depression, such as the Edinburgh Postnatal Depression Scale, which is it's most commonly used, and it has got very high level of acceptability. This tool, EPDS, has also been translated into various languages, including Kiswahili. Actually, during the preparation of this presentation, I came across research that has been done by our very own researchers, Dr. Linet Ongeri, Dr. Bwayo, Dr. Madai, and others, who have actually used this tool, and they actually translated it into Kiswahili. So this is a tool that is readily available for use. It has been used in other continents as well. It has also been used in East Africa, like Uganda. So this EPDS is a self-report scale that measures the presence of depressive symptoms in postnatal period. Once the symptoms are screened, healthcare professionals have the opportunity to establish interventions and early treatment, and this may minimize the negative effects of PPD to the family. Screening has been shown to have good efficacy for preventing long-term mental ill health. Cultural barriers, including fear of stigma and lack of validation of depressive symptoms by family and society, may also make people to avoid, expressing what they are going through. But this tool would be able to pick out some of these symptoms, and it is very, very easy to use and very simple. The complications of PPD for mothers, if it is left untreated, and this can last for months or even longer, and sometimes it can become chronic. And even when treated, PPD increases a woman's risk for future episodes. So this is someone who needs constant support, especially if this is someone who has been diagnosed with PPD, or if there's a history of depression in the family or mood disorders in the family. This is someone who needs constant support throughout pregnancy and also after pregnancy. And by support, I mean physical support and also psychological support. For fathers, postpartum depression can have a ripple effect, causing emotional strain for everyone close to a new baby. When a new mother is depressed, the risk of depression in the baby's father may also increase. And new dads are already at increased risk of depression, whether or not their partner is affected. And this is because men generally do not express how they feel. For children of mothers who have untreated postpartum depression are more likely to have emotional and even behavioral problems, such as sleeping and eating difficulties, excessive crying, and delays in language development. Tips that can help you cope with bringing home a new baby: ask for help and be ready to receive help. Be realistic about your expectations for yourself and your baby. Exercise within the limits of any restrictions your doctor may place on the level of activity, like taking a walk or get out of the house for a break. Expect some good days and some bad days. Follow a good diet, avoid alcohol and caffeine. Foster the relationship with your partner. This is a time that you need to be really close to your partner. Make time for each other. Make time for intimacy. Keep in touch with family, friends. Don't isolate yourself. Limit visitors when you first go home so that it can allow you to heal and also bond with the baby. Sometimes you can be overwhelmed by visitors and you're also really trying to bond with the baby. Screen phone calls and limit social media time. Breastfeed while looking at your baby. Do not watch TV or engage in social media. And why is this not advised? And I'm sure Dr. Kigondu, who is here, will be able to even explain this further, because it stimulates milk production. When you breastfeed while looking at your baby, it stimulates milk production. And it also helps you to bond with your baby. Eat nutritious meals and sleep or rest when your baby is sleeping. Treatment. While PPD is a serious condition, it can be treated with medication depending on the type of symptoms and how severe they are. Remember, on the onset, I'd said for this condition to be diagnosed, you have to look at the length of time, you have to look at the severity of the symptoms. So treatment options include anti-anxiety or antidepressant medications, which are safe for breastfeeding mothers. In case of postpartum psychosis, drugs used to treat psychosis are usually added, and hospital admission is also often necessary. Psychotherapy and participation in support group for emotional support and education are very important for one's mental wellness. In a support group, you don't feel alone. You feel that, so there are also others who are going through the same, and I can be able to work through this. So it gives you motivation to be able to work through your problems. And actually at Kisiwa, we have various support groups that can be able to help people who are going through various issues, including mothers. Psychosocial and psychological interventions during pregnancy have a possibility to reduce the incidence and improve the outcomes of postpartum depression. This is based on studies that have been done over the years. Children born to mothers receiving treatment for postpartum depression or mothers who had remission of such symptoms have a higher chance of normal development as opposed to children born to mothers with depression without treatment. So this is just to emphasize the point that treatment is very key for someone who is going through PPD or paternal PPD. And sometimes, as I'd mentioned earlier, admission is necessary to monitor, for one to be monitored, because remember I'd said that there's an increased risk of suicidality among those who go to develop postpartum psychosis. And even for fathers whose symptoms go untreated, yeah, they end up, they may need to be monitored. In my conclusion, I would say that if you don't get treatment for PPD or paternal PPD, the symptoms can get worse. When your ability to function is affected, you need to see a healthcare professional, such as, your doctor, your primary doctor, or your gynae. The doctor can be able to screen for depression or for depressive symptoms and come up with a treatment plan, and which, for best practice, usually will include, bringing in mental health professionals to also help with psychotherapy or psychosocial support. The overall success rate for treating postpartum depression is 80%, according to research. As with all forms of mental health conditions, early recognition and treatment of postpartum depression can lead to better symptom management and faster recovery. Healthcare and mental health professionals need to design interventions that are more supportive of men, because men also suffer when their spouses experience postpartum depression. There is need to combine mental health care alongside maternal care services during postpartum period. Providers of maternal health care need to be aware of and receive suitable guidance on psychological issues when providing care for pregnant mothers when they're attending clinic and even after delivery. Sensitization about the importance of screening for PPD may help to prevent or identify or even treat PPD or paternal PPD in the early stages. Thank you very much for listening to me. I will now take it back to the moderator to address any questions. So remember, taking care of yourself is the most powerful way to begin taking care of others. And as healthcare workers, it's important to be able to bear in mind that when this happens to you, you need to allow yourself to be helped. You are a patient at that particular time. There's an assumption that as a healthcare worker, you should know exactly what to do. But when this happens, allow yourself to be helped so that you can be able to overcome this. Thank you very much. I will stop sharing my screen as I take it back to Francis.
Thank you very much, Jacqueline, for the wonderful presentation. There are a few questions on the Q&A sections, which I will direct to you, as has been asked by the attendees. One question is by Peter Mahiti. He is asking, how should you handle a situation of PPD when there is increased hostility towards the spouse alongside some of the symptoms you presented?
Do I answer that one or I wait for you to ask the others? I answer all of them.
Okay, the second question, how does one sleep during daytime when baby sleeps? This can make one be awake all night, sleep hygiene. So I think you can just answer both concurrently.
Okay, thank you very much for the two questions. Remember, sometimes at night, the baby will keep you awake. So you find that you may not be able to even get that sleep hygiene that you're looking for. So it's important to be able to rest as much as possible whenever your baby is sleeping. And also remember, you need to be energized in order to be able to take care of this baby because of the demands that are placed on you as a new mother. So it's important to try and catch sleep anytime, whether it's during the day or at night. Probably as the baby grows, you may find that the baby's sleep time may change, and you may find yourself actually sleeping more at night. How to handle hostility? Francis, please confirm, is this hostility towards from your spouse or from family members?
Towards the spouse, alongside some of the symptoms you presented. I think it's directed towards the spouse.
Okay, all right.
Yeah.
Okay, I will answer this, and I will also welcome Dr. Kigondo to also answer the other bit. The hostility comes in because of the overwhelming symptoms that this woman is experiencing. So you find that the person who is nearest to this person is the spouse. And you find that all this anger may be displaced on the spouse, because remember, even the person going through these symptoms may not actually understand what they are going through. Yeah, remember, it comes at a time when there's a bundle of joy, but what you're feeling, you're not feeling happy. Yeah, you're overwhelmed by the kind of symptoms that you're experiencing, which even you don't understand. Yeah, the society also around you may not be able to understand what you're going through, and most of the time you find that you are blamed. You are blamed, and sometimes, as I say, there are also cultural explanations as to what you are going through. So you find that all these things would be overwhelming for you as a mother going through postpartum depression, and you may displace it on your spouse. On the other hand, also, your spouse, because your spouse also doesn't understand what is going on and is not able to fix this problem, you may find that your spouse may also get into conflicts, get more anxious, and is unable to know how to handle the situation. So your spouse may also be displacing it again on you, or even onto others. So that is how this hostility tends to happen. Dr. Kigondo, you can also add something on that.
Yeah, I'm lucky we have several gynecologists on the panel list. We have Dr. Diana Marion, Dr. Joki Fernandez, and Dr. Carol Odula, and I think they can contribute to that. But I think the topic is very important, as men are normally forgotten. As we concentrate on the ladies, then we forget the men, who are actually should be used as partners in managing the lady undergoing postpartum depression, because it's sort of a partnership. But more importantly, I think we have screening tools to identify people who may be at risk of developing postpartum depression before they deliver. These, as we say, prevention is better than cure. I think majority of people seeing expectant women need to be administering these tools so that we do not reach the stage where someone actually goes into postpartum depression. And maybe these tools need to be availed more to those who are caring for mothers who are expectant. And also we need to encourage the men to attend antenatal care together with the ladies, so that they are able to understand the changes that the ladies undergo when they're expectant, that can lead to these postpartum depression and all, because it is easier when you have people who are knowledgeable to manage than before. And I would welcome Dr. Carol Odula to make a comment on the same. Dr. Carol Odula is an experienced gynecologist who has seen a lot of this. Dr. Carol Odula.
Hello. Good evening, all. Good evening. Oh, excellent, Jackie. You've done a great job. You have actually done a great job. We do encourage men into the discussion very early. It's not only for payment of bills and things like that. We encourage men to also attend the classes where we teach women about labor, about breathing techniques, about care of the baby. This brings the man into the picture very early into the discussion, as Dr. Kigondu alluded to. So that's really very important. Do not leave the men behind. Involve the men in, labor room, cutting of the cord, changing of the diapers. Let's all learn together. It's a joint effort. This way, we are actually not keeping the man away. To go back to Jackie, also, when a woman is experiencing a loss, involve the men. Let the man go through some sort of counseling. It's not only the woman who has lost, it's a couple who have lost. So let's involve the men in the joys and in the sufferings. Thank you, Dr. Kigondu.
Thank you very much. I think we can also get, before we come back to you, Francis, sorry for taking over that. Dr. Diana Marion is a consultant gynecologist and also the Assistant Secretary General of KMA. She can make a comment and then we get back to Francis.
Thank you for the presentation. Quite thought-provoking. I think the reason why I really got excited with the presentation is the fact that the postpartum depression affecting men has been brought out very nicely and very clearly. And sometimes you will get, as a gynecologist who is practicing, you will get the women complaining a lot about not being supported. They feel they are alone in that journey. So now you tend to also now look at the approach as a doctor or as a healthcare provider, how you would put it down such that we don't really just imagine it's only the women that get affected during this period. So I'm really, really happy about this, which means that we are really going to improve how we manage our clients. And the fact that we have both women and both men affected as we travel the journey of pregnancy and delivery, both the antepartum and postnatal, we are going to also concentrate on also looking at the journey that the male partner is going through. Thank you for this presentation.
Thank you very much, Dr. Simon, Dr. Diana Mario, for the wonderful comment. Thank you very much, our presenter today, Jackie Anundo. We have done a wonderful job. Before we conclude, I'm going to invite.
Sorry, Francis, we still have some questions in chats. We have questions in chats.
Oh, sorry, I didn't notice that. Okay, we have two new questions. One
in the chat.
Yes, in the chat. In question and answer, there is a new question actually. What is the most common administered first-line medication for PPD? In the chat, there is also another question. As I find the question in the chat, I think Jackie can handle the question in the Q&A section. What is the most common administered first-line medication for PPD and PPD? Jackie, karibu.
Okay, I will pass that question to the doctors in the house, but I'd like to take another question that I can see here. Is there a place for behavior modification therapy for people with PPD? And I would say yes. Once one is able to overcome the depressive symptoms, then it is possible to also introduce behavior modification therapy, because there could be other underlying issues that need to be handled that could have exacerbated, the onset of the depressive symptoms that this particular new mom or new dad is experiencing. So I'd like to hand over the question on first-line medication to the panelists. So any panelists in the house can be able to take that question.
So thank you very much, Jackie. In the spirit of the multidisciplinary approach, we normally consult the team from the psychiatrist, and they come and assist us with management depending on the situation. Postpartum blues may not require any medication per se. It may do with psychotherapy, but the psychiatry team would engage the management team. I've seen a question on methyl dopa and depression, and yes, methyl dopa aldomate is known to have a side effect, so to speak, of depression, and may actually, if a mother has preeclampsia and is exhibiting signs of postpartum depression, then they may consider a change of the medication for hypertension to avoid aggravating the situation. But a lot of the medication that we give should be centrally active. Francis, I don't know.
Okay, there is another question. I don't know whether you've handled this, but a hormonal etiology is pointed out in the pathogenesis of maternal PPD. Is there a hormonal influence responsible for paternal PPD, or it's purely psychosocial phenomenon?
Okay, I can take part of the question, and any panelist can also to take the other part of that question. Yeah, in my presentation, yes, there's normally a drop in hormonal levels, estrogen and progesterone for mothers. When it comes to men, there's also a drop in testosterone levels, and research has found that when this hormonal level drops, then they noted that there was an increase in depressive symptoms. in this particular study. So it is not purely a psychosocial phenomena, but there's also a hormonal influence that is responsible in the etiology. Anyone in the call can be able to add on to that.
Yeah, thank you very much. We would need to look that up, but I think
it's 20 hours.
We know the influences of psychosocial influences. Another person's behavior will also tend to affect your behavior. So already, obviously, there is a big psychosocial aspect to the male PPD. We will need to find out if there are any hormonal changes to that. But my take is that I think it's mainly psychosocial.
Thank you, Dr. for the response. I believe we have done our best to handle the questions in the chat section. I think before we end the session, I'm going to invite Elizabeth to talk about the call center before we move to the next step. So, karibu, Elizabeth.
Thank you. Peter, please project. Thank you, Peter. So the call center is open and still operational for our healthcare workers. We start actually work at 6. We should correct this in the morning, all the way up to 10 p.m. every day. The call center is for us and our families. So if any of us is going through issues like the topic today on PPD, if anyone you know is going through those issues, or if any healthcare worker is going through these issues, we need to call in and get help from this call center. It's ours. It's run by healthcare workers. In fact, our moderator today, Francis, who is a medical psychologist, is part of our call center staff. So we really need our healthcare workers to be able to reach out. We are happy. We have been getting more and more calls, and more healthcare workers are reaching out. So anybody who is struggling, or a family member who you know needs to get mental health support, we welcome you to call. Please pinch out and copy the numbers or take a screenshot, so that you are able also to share these numbers with other healthcare workers who have not been able to join us today. Thank you. Back to you, Francis.
Thank you very much, Liz, for talking about the call center. I would like to appreciate all of us for being with us during this session. Everyone, we thank you very much, and may God bless you. I'm going to invite Dr. Josephine Ohas to maybe give closing remarks before we end this session.
Good evening, everyone. Thank you so much to our presenter, Jackie. Thank you to you so much for also moderating this session. Thanks to our participants for participating. This was a very timely subject of discussion. So tunasema asante for taking the time. And of course, to the rest of the panelists, asanteni. See you all next Tuesday at the same time. Asante.
Good night. Thank you, Jackie.
Thank you. Good night.
Thank you. Good night, everyone.
Thank you.